Should I breastfeed while I'm on my medications? And um, yeah, so this is a really big topic. I'm going to do my best to kind of distill it down. And remember, your mileage may vary. So your particular situation should be discussed with your particular clinician. Now, with that said, in the world of pediatrics, so I am a pediatrician. I trained as a pediatrician. I don't practice it just because it's kind of actually really hard to do that in an independent setting. Another topic for another day. Um, Most pediatricians all recommend breastfeeding if possible. Breastfeeding gives lots of benefits, especially when it comes to maternal bonding and attachment, when it comes to getting healthy antibodies, when it comes to nutrition, like breastfeeding. Breast is best, as they say. And so if you can do it safely, then by all means, we're going to encourage you to do so. Now, there's this whole other like unusual movement in the breastfeeding world where they talk about like kind of shaming, and I'm not into that at all. So there are some people who cannot breastfeed for any number of reasons. We want to make, I want to make sure that I let everybody know that if you can't for whatever reason, that formula is perfectly fine. The formulations of formula, Enfamil and Similac and all the rest of those things, your pediatrician will walk you through what is best for your baby. And they're very safe and full of nutrition, and your baby's brain and body development will occur just the way it's supposed to occur. So I just throw that out there. Now, when it comes to those moms who want to breastfeed while they're on psychiatric medicines, it all depends. I'm going to put a big old asterisk up there because it depends on what medicine you're on. In general, a lot of the research is really not great when it comes to what meds are best to be on during breastfeeding, because it's kind of unethical to kind of check that. Like, we can't walk around and be like, hey, sister, start taking this medicine and let's just see what happens to your kid. That's not how we do things. And so a lot of the data that we get is not the randomized controlled trial double-blind placebo stuff that we normally do for all the other things. And so, but in general, we have a general list of medicines that are generally safe. And then we have a list of medicines that are generally not safe. And there's over 100 different psychiatric medicines, so I can't go through them all. But there's kind of a ranking that the FDA uses for safeness in lactation, is what they call it. And there's different classes, and I always get them backwards because it's like A, B, C, and D. And I want to say A and B are bad. Like, use caution if you're gonna be on those medicines, i.e., don't be on them. And then C and D are less bad, but they're not necessarily saying good. And so, how does a psychiatrist decide with the patient if they want to stay on their medicine? It is an individual conversation with every single person at that particular time. So, for example, if a person is not doing well and they're having difficulty with postpartum depression, well, we know that the risk-benefit ratio um, um, is different depending on what's going on. So if there's a new mom and they are depressed and they're not able to enjoy the bonding experience because they are dealing with issues of sadness and that sort of thing, it may actually be helpful to go ahead and be on an antidepressant and then breastfeed and then bottle feed the baby instead. Or if the mom really wants that attachment, if they really want to have that experience, we do what we call informed consent, which is a fancy doctor term. That means we lay out all the risks, benefits, and side effects, and then that person gets to choose what they want to do. Because the idea of paternalistic medicine, where I'm telling you what to do and you're going to do what I tell you, all that stuff is going by the wayside. And so we want to make sure that all of our patients have an informed understanding of what's going on. And then if you choose to do that, then it's my job to walk you through that safely. And so there are a couple other instances where a lot of times psychiatrists will say, hey, I think it's actually a really good idea to go ahead and get back on your medicine, especially in the cases of like schizophrenia or bipolar, because if you're off those medicines for a really long time, they can cause their own issues, mental health issues, to the point where you could, lose function and all sorts of stuff happens if you're not consistently stable, and we don't want you to be a danger to yourself or to anybody else, especially to your new baby. And so, yeah, so lots of different reasons why somebody would would go back on a medicine. Some people have to stay on their medicine during pregnancy. Some people are able to come off and they can breastfeed and do all those things. And I've even seen some moms having a diagnosis, a psychiatric diagnosis before they were pregnant. They got pregnant, came off their medicines, and then the diagnosis was actually gone after they had the baby. And we're like, how did that happen? And so, yeah, so pregnancy is this amazingly strange transition for lots of folks. I've personally never been through it, so I can't speak for everybody. But in general, make sure that you're talking to someone who is very knowledgeable if you're on a medicine and you're going to get pregnant or have become pregnant and want to breastfeed, because there's a lot of planning that goes into that to make sure that you're safe and to make sure the baby is safe. So that's the quick and overly simplified version of breastfeeding and medications, psychiatric medications.